Senator Alexander.
Thank you. Thanks to both of you for your remarkable work and for being here. You said, Dr. Frieden, that our focus should be on reminding pregnant women that they should try to avoid being bitten by a certain type of mosquito. That's really the focus of what we're talking about, right?
Well, first, to avoid going to a place that has Zika spreading, and for those who are
living... But the goal is pregnant woman, certain type of mosquito. Yeah. That's what we're really... I mean, if you're not a pregnant woman, and if there are none of those types of mosquitoes, this is not a concern. Is that correct, or is that not correct?
That's generally correct. There might be a small exception for men who may be infected and whose partners may be pregnant. But
no. Where does one... I mean, I go fishing in Minnesota and Canada. There are lots of mosquitoes up there, but I gather those aren't the mosquitoes likely to carry this virus. If you were about to travel, where would you go to get the best list today of the places where you could go where you're not likely to be affected by this type of mosquito?
The CDC website will have that information updated on a regular basis.
If a pregnant woman's husband has traveled to an affected country, what precautions should that couple take?
We recommend at this point, until we know more, that if they have sex, they use a condom.
If a woman is planning on becoming pregnant and if she's traveled to an affected country, how long should she wait before she becomes pregnant?
There's still a lot we don't know, and so we are giving information to the public and to the obstetricians about situations like that. Mm-hmm. We believe that if someone has been infected on the last day that they were somewhere, they could get sick for about 2, maybe 3 weeks. After that, the virus would be out of their blood, and if this behaves as other viruses behave, there would be no increased risk to the next pregnancy after some period of a month or so, but we don't know that for sure.
So while you don't know for sure, 4 to 6 weeks after returning from an affected area would probably mean the virus is gone.
I don't know what Dr. Fauci would say, but I would say that is
what
probably...
advice would...
I would think that would be... Senator, I would think that would be a reasonable assumption, but then, just as I said in answer to one of the other questions, you really want to do a natural history study and study a lot of people and know really how long it is until that virus is gone. I would think 4 weeks would be reasonable, but before you say definitively, we really want to do the studies that we are doing.
Does this virus have an effect on a newborn or a toddler whose brain is not yet fully developed?
We don't know the answer to that. We have not seen reports of adverse effects.
You may have answered this, but on diagnostic tests and vaccine, if I'm a pregnant woman and I want to know if I have the virus, who do I call?
Your doctor should get in touch with your local health department.
And what will your local health department do?
If you're actively ill, they'll use the CDC tests that accurately can say whether the virus is in your blood. If you weren't ill or it was a few months since you traveled, your local health department will do a CDC-developed test that may be able to determine whether you've been infected.
But you're likely not to feel ill. Did you not say to us yesterday
That's correct.
80% of the time there are no symptoms?
That's correct.
So you might return from an affected area. You may feel good, but you may worry that you might have contracted the virus. The chances are 4 out of 5 that you don't have any symptoms. So you still call your local health department. Do you have enough diagnostic tests to meet the need?
We're working around the clock to scale that up. We're already in the process of sending out 62,000 tests developed at the CDC lab, working with private companies to try to do more, but there may be a period of weeks or a couple of months where there aren't enough tests for the people who will want to have them done.
Dr. Fauci, you sounded yesterday in our discussions that you felt pretty confident that there would be a vaccine. And it sounded like the amount of time it could take might be as quickly as 12 or 15 months. Is there anything we should do to speed that up? Help you speed that up.
The answer is I don't think we can, but I want to clarify for the committee exactly what I meant when I said 12 to 15 months. if you look at the natural way that you would get a vaccine approved with all the I's dotted and T's crossed through the FDA, in which you did a trial where you definitively showed that it worked, that generally would take for a vaccine like this anywhere from 3 to 5 years. The point that I made about an accelerated approach was that we know we can start early trials, probably by the end of the summer in phase 1, just to ask the question, is it safe and does it induce an immune response that you would predict would be protective? Once we get that finished, which would likely be by the end of 2016, if the epidemic is still raging, let's say in Brazil, and you have enough people who are at risk for infection, you could go into an accelerated phase 2 trial, and probably within a period of 6 to 8 months, you'll be able to definitively say whether it works. If that circumstance exists, then you could ask for an accelerated approval from the FDA or from whatever regulatory authority is involved, which would truncate that 3 to 5 year period to much shorter. However, if there are no infections around, which is exactly what we saw when we got to that point with the Ebola vaccine, just as we were getting ready to do the definitive trial because of the public health capabilities and what CDC and others had done in West Africa, there were no new cases. So we were unable to definitively show it works.
Mr. Chairman, my time is up, but you've taken me toward the end of 2017, and assuming there's a raging epidemic,
Then
you've still got a period of time for manufacture, or does that go pretty fast?
For the product that we're talking about, that goes pretty fast, Senator. And that's the reason why we're engaging the pharmaceutical companies right now in anticipation of that.